Knock, knock, knock.
Hi.
Good morning. My name's Callie. I'm a student nurse at the University of Southern Mississippi. How are you?
I'm good.
Okay, well, today we're going to be doing a head-to-toe assessment. It should take 10 minutes. Can you verify your name and date of birth for me?
Diamond Banks, February 28th, 1999.
Okay, and it matches your wristband, so that's great. So first I'm just observing your overall appearance. You seem to be your stated age. You're dressed appropriately for the weather and for the occasion. Your skin temperature feels warm, it's of appropriate color, and I'm observing that there's no tinting when I test your skin turgor. Do you have any pain today by chance?
No.
Okay. Everything seems to be great. Your eyes, everything. You have no odor about you. You have no pain, which is great. I'm going to go ahead and start taking your vitals. Okay. I'm going to start off by putting on pulse ox on your middle finger. I'm going to take your temperature. Put this under your tongue. Alright, and your temperature is 97.7, which is in normal limits. And your pulse ox is 97, which is also within normal limits. I'm going to go ahead and take your blood pressure. Is there an arm you prefer?
Right arm.
Okay. Alrighty. Alright, is it too tight?
No, that's good.
Alright. Let me know if you feel any discomfort, okay?
Okay.
Okay. So, your blood pressure was 116/74, which is within the normal limits. Okay. So, next I'm going to go ahead and just take your radial pulse for 30 seconds. Excuse me, I'm just trying to time it for you.
It's okay.
Okay, so your pulse was around 80 beats per minute and you have 14 breaths a minute, which is all well within the normal range. I'm going to go ahead and start your head, eyes, ears, nose, and throat. I'm going to go ahead and look at that. If you don't want to take off your glasses for me. So I'm going to shine this light in your eye. It might be a little bright, but it's just for a couple seconds. And I'm just checking and making sure that her eyes are reactive, which they are. The pupils are dilating brisk and quickly, and they're dilating at identically, I guess I should say. Can you go ahead and just follow this towards your nose? Okay. And you're going to go ahead and follow this way. So keep your eyes on the pen. Alrighty, so everything checks out and looks great. I'm going to have you lean your nose back and look inside. Okay, it's pink and moist, and there's no obstructions or anything like that. And I'm gonna have you open up your mouth and stick your tongue out and say ah. Okay. And everything seems to. You gonna be having any pain in your throat or anything like that?
No.
Okay, because it looks normal. It looks pink and moist like it should. I'm gonna go ahead and palpate your ears. Have you had any pain in your ears?
I have not.
Okay, and I'm gonna check for the pearly white tympanic membrane. Everything looks good. Okay, so next I'm gonna go ahead and ask you some questions. Do you know why you're here today?
Yes, I'm here for a head to toe assessment.
Okay, do you know the date of today?
It's November 4th, 2019. 14th.
Okay, and do you know the President of the United States?
Donald Trump.
All right, and can you go ahead and do this for me? Okay, so she is awake, alert, and oriented, and you can follow simple commands. So you have a Glasgow scale of 15, Glasgow Coma scale of 15, which is great. I'm gonna go ahead and listen to your heart sounds now. So I'm gonna start at your aortic, and then we're gonna move down. So you can just sit normally, relax. I'm gonna first, excuse me before I start, I should probably ask you, have you felt any pain?
No.
Okay.
No pain.
No pain, no crepitus or anything. I'm palpating for that. There's no masses, no lesions. Everything looks to be of normal standards. I'm going to go ahead now and listen. Everything seems to sound clear and good. Do you mind leaning forward for me, please? I'm going to go ahead and listen for some murmurs with the bell of my stethoscope. All right. Don't hear anything abnormal. So I'm going to go ahead and feel your peripheral pulses. I'm going to go ahead and check your radial pulse, which both are 2+. Your brachial pulse, these are also 2+. And I'm going to do your dorsalis pedis pulse, which are also 2+, which is great. I'm going to go ahead and start your respiratory assessment. So anytime I put the stethoscope on you, I'm going to have you breathe in through your mouth and out through your mouth, okay?
Okay.
Once again, inspecting, making sure your chest doesn't have any abnormalities or masses as we just did. And then I'm going to also do your back when I rotate around, okay?
Okay.
And breathe in. Not hear any crackling or wheezing, which is great. I'm going to go ahead and go to your back and palpate and make sure everything is as it should be. There's no masses. Do you have any pain?
No, I don't.
Okay. So every time, once again, I put the stethoscope on you, if you could breathe in for me.
Yes.
Okay, and there's no crackles or wheezing, which is as it should be, which is great. So I'm going to go ahead and have you lay on your lateral side for me, please. And I'm just going to finish off checking that there are no murmurs and no abnormalities using the bell of my stethoscope. We're also going to be listening to S3 and S4 sounds of your heart if there are any apparent. I'm gonna go ahead and have you lay on your back. I'm gonna do an abdominal assessment, but I'm also gonna listen to your apical pulse since it's just a more comfortable position to have you in. So I'm gonna listen to that for a minute and then we'll start on your abdominal assessment, okay?
Okay.
Okay. So your apical pulse was about 86 beats a minute, which it was 86 beats a minute, so it's good. I'm gonna go ahead and have you lift your shirt up for me, and I'm gonna start off an abdominal assessment by inspecting, and there doesn't seem to be any discoloration or distension of the abdomen. Have you had any problems with your digestive system lately?
No.
Okay. Well, I'm gonna go ahead and listen to your right lower quadrant. And we're just listening for the clicks and the vowel sounds. Go into the right upper quadrant. I hear them. We're going to the left upper quadrant. And then the left lower quadrant. Okay. I did hear sounds of all four, which is great. When was your last bowel movement?
Yesterday.
And could you describe it, like what the consistency and color of it?
It was formed,
Mm-hmm.
brown, and soft.
Okay, so there's no pain or anything like that when using the restroom?
No.
Okay, I'm gonna go ahead and do some range of motion exercises. You can go ahead and put your shirt down if you need to. Go ahead. And I'm gonna palpate as well. I just think it's more comfortable sometimes doing that. Do you have any pain as I press on you?
No.
Okay.
No pain at all.
Okay, perfect. So, I'm gonna go ahead and ask you to put your knee to your chest. Okay, put it down and put this one as well. Okay, and if you want to go ahead and sit on the side of the bed, I'm gonna have you shrug your shoulders like this, put them down and then shrug them with resistance. Okay, and then just turn your head from side to side, and then go ahead and put your arms out, and then push up. Okay, and flip your arms over, and then push down. And I'm gonna do the same for your legs. Pull and push. Okay. Do you use any assistive devices?
No.
No, you don't.
Independent walker.
Okay, perfect. Before we, I'm gonna have you walk across. Before we do that, I'm gonna go ahead and palpate. Have you had any tenderness in your neck area?
No.
So I'm gonna palpate your lymph nodes. Okay, and I'm gonna go ahead and palpate your thyroid gland. So could you go ahead and swallow for me? And then swallow one more time. Okay. Everything seems to be good. I don't feel any masses. I don't see anything. So that's perfect. So I'm going to go ahead and have you walk across the room. Go ahead. You can watch that red stethoscope. And I'm just observing your gait, making sure you don't have any foot drop or anything like that or any unsturdiness. You can go ahead and sit down. Okay, so that's the end of your assessment. Do you have any questions for me?
No.
Everything, you have any, all your questions are answered today?
Thank you so much.
Okay, you have a great
Have a
day,
great
Miss
day.
Banks.